This is the Get Healthy 360 podcast, where we discuss topics related to your physical, mental, psychological, and spiritual health. Your host is Dr. Kris Ferguson, board certified in anesthesiology and pain management. This podcast is for informational purposes only, and you should consult your primary healthcare provider before making any decisions related to your health. And here's your host, Dr. Kris Ferguson.
So today we have with us Nicholas Maraj. Nicholas is a specialist in anxiety and depression. He practices in the Greater Toronto area. He has a fantastic background in depression, anxiety. He's also had a really interesting stint where he traveled all over Indonesia and worked with people in Indonesia, really learning that culture, learning different ways to view anxiety and people. And then he finished his master's, and now he's doing therapy in Toronto. So, Nick, thank you so much for joining.
Yeah, Kris, thanks for having me. It's been a real pleasure.
So do you want to give a little bit more of your background if I missed anything?
Yeah, well, just as you said, and I appreciate the intro, I'm a psychotherapist in Toronto. I primarily work with anxiety disorders and depression. Usually the two, they go hand in hand. It's rare to find somebody who is experiencing one that's not being touched by an element of the other. You know, as you mentioned, I'm an avid traveler, love just exploring the world, seeing what it has to offer and the wisdom that I can connect to from it. And yeah, as you said, my travel to Indonesia and all through Asia, etc., you know, it actually has informed my practice, and it's allowed me to see things that sometimes the Western eye can miss. You know, I think we get caught up in our own bubble of what can be helpful and what's useful, and to step outside of that was really powerful for me.
So what would you say, so what is a psychotherapist?
Essentially, a psychotherapist is somebody who, you know, I guess to get technical, a psychotherapist would be somebody who works with people with mental health challenges. And, you know, the umbrella of a psychotherapist could be, you know, it could be a family doctor, a psychiatrist, a psychologist, et cetera. There could be a lot of people who practice psychotherapy. But what we do is we work with somebody, often in 1-hour sessions or in group sessions, and we help people understand what their current experience is. You know, we help them understand the patterns of thinking and how that might interact with physiological experiences, how that might interact with behavioral experiences and relationships. And we try to give them a pathway to create a sustainable, what's the word I'm looking for? We just try to give them a pathway so that they can heal themselves in a sustainable way. And sometimes that includes behavioral therapy. It might include cognitive therapy. It might include meditation practices. But we essentially just try to give people a framework and a pathway so they can live a life that feels good for them.
Well, and it seems, so I'm a pain physician, so I deal a lot with anxiety and depression and the interplay between how that affects pain as well. And it seems, what would you say is the percent of the population that has anxiety and or depression?
That's an interesting question. What I would say is that I think 100% of the population has had experiences, moments of being anxious and moments of feeling sadness. But from a clinical perspective, you know, those who we would say have a depressive disorder or an anxiety disorder, you know, that's tough to say. There's stats would differ. From anecdotally and just from what I've seen in my practice, to me, it feels like there's quite a high percentage, even higher than the reported number, which is often in the range of 10 to 15%. You know, I think that a quarter to a third of people will have a really difficult time with either of those in their lifetime.
So what's interesting is that I think a lot of anxiety goes undiagnosed because, say someone is in a specific job or in a relationship or in a situation that is not really fulfilling what they want, they will stay in that situation. And correct me if you disagree, but they would stay in that situation because of anxiety, because of fear of change.
That's an interesting point. I think that you've probably hit something on the button there. So essentially, when we look at anxiety, what triggers it is the perception of danger or threat. You know, anxiety is a natural, normal human emotion. It's actually really functional and useful for survival. If we didn't have anxiety, we wouldn't be able to detect danger and thus stay safe and healthy. So for different people, let's say the example you used in a relationship, it might be really frightening for them to leave a relationship. Now, logically, we would think if the relationship's not working, one should go do something different. But what I believe and what I've noticed is that the unknown feels psychologically unsafe. So paradoxically, people stay in situations that are unhealthy for them because they're familiar. On a psychological perspective, safety and familiarity equals safety. So people will often stay in a place that's actually not healthy for them because psychologically it feels safe, meaning it feels familiar. And to do something different is unsafe. And this is part of why we see people having a tough time with changes in jobs, relationships, etc.
So I would say that my baseline level of anxiety tends to be very low. If I'm in a situation that I don't particularly like, I don't have a lot of trouble identifying and saying that this is not a good situation for me and leaving. So while that's positive for me trying to help someone with anxiety would not work because what would be obvious to me is not obvious to them. And it's hard for me to see things from their standpoint. I can intellectually understand it, but from an emotional standpoint, I don't connect. So, in a conversation, I think you were discussing how you had some anxiety, which I'd be the first to say, I think that makes you a lot better therapist because you can empathize a lot better with the people that you're treating.
Well, absolutely. My own experience with anxiety, which occurred primarily in my teenage years and early adulthood, that really informed my motivation to understand anxiety and find ways to transcend it or overcome it and shift my relationship to it. So one of the pieces here, and I think this is incredibly important for any healthcare provider to realize and remember, is that validation of one's experience, whether or not we can understand it, is really powerful for creating healing and change. So sometimes we might say, well, just leave, get out of the situation, or just change. And we know that that's true. However, when we tell someone to change and they feel stuck and they can't do it, it makes that person feel like they are wrong. They feel invalidated. And that creates a sense of shame, which further traps them in their situation.
So you just brought up some really good points about how if you have to acknowledging what the situation is that's causing you anxiety, even just acknowledging it can cause a lot of shame. But I think a lot of people have things that have happened to them that they may not necessarily be comfortable talking about. But I think the underlying human experience is everyone has bad things happen to them. Everyone has things that they're kind of embarrassed about. So is there are you willing to talk about experiences that you've had that have caused you anxiety and made you, I would say, very good at treating anxiety?
Yeah, absolutely. I think that's a really important area to look at. For me in particular, there were a lot of factors that I look back on now, and it helps me to understand my anxiety. One of the things for me that was a significant challenge was being picked on, bullied growing up. And for me, that actually happened in the context of a relationship with my older brother. And, I know that can be pretty common in a lot of relationships. And I would say that what I experienced might have been a little bit different. My brother went through his own anxiety, depression phases, and I think he clearly didn't understand how to deal with that, took it out on me. And what happened was that growing up on a daily basis as a kid, any given moment, any given day, I didn't know if I was going to be punched, kicked, beat up. So I was in this constant state of uncertainty and fear. And I think that just really kept me, when we look at anxiety from a physiological perspective, my sympathetic nervous system activation, which is sort of that fight or flight system, was on constant high alert. I felt like I couldn't really relax, couldn't rest. If I'm speaking too loud, I don't know if that's going to lead me to get pushed around. If I say no to something, it might sound like maybe it could be a more everyday mundane thing, but for me, that kept me in a state of just uncertainty and high alert. The other element is that my mom also struggles with anxiety, and she has a great heart. But one of the things she did, thinking perhaps it was the right thing to do, was she was quite fearful. Anytime I would go outside or anytime I would do something, she would say, "Nicholas, be careful," or "watch out." Or if I tell her about an opportunity, she'd say, "But are you sure you can handle that? Will that be too much?" So there was always this messaging that I was receiving that said, "Be careful, watch out, be on high alert." So I think those two factors created a heightened sense of awareness of danger in me. And I think that really led me to question myself. I didn't feel so confident in making decisions. I wasn't so sure if I could handle some of the deeper challenges. And I didn't really know that that was what was going on. I just kind of dealt with it. And as a typical guy, I kept it to myself, feeling really afraid to let anyone know that I felt vulnerable, that I felt afraid. I just, acted like everything was okay. So what I ended up doing was, like a lot of guys, I kind of shut myself down. I became pretty numb, and I didn't really, I stopped being expressive of my emotions. That's how I dealt with it, at least at that age. And I think when you don't deal with your emotions, when you suppress them and don't express them, they end up coming back with a vengeance. And that's what happened to me in my teenage and early adult years.
So just my comments on this is, it seems like you're discussing or describing a very common situation I see. I think there are a lot of typically women in abusive relationships that feel like they can't do any better, so they're stuck in these relationships and then they're put down and told they can't go somewhere else. But on the flip side, I think there are a lot of men and women that are in professional situations where they don't get good reviews or their boss is hard on them. And then they feel like they can never get another job because they're not the best employee. They're not the best worker. So they stay in these negative situations that's just continually reinforced. And the longer they stay in these situations, the harder it feels like it is to leave. But I think that's why having a therapist with some sort of deep understanding of what they're going through is really the person that they should go to. And I think it takes a lot of courage to deal with your emotions. I think it takes a much stronger person to say, I have this issue, so I'm going to deal with it. And sometimes what I've told people is, you can get a personal trainer and no one would think a second thought of, I have a personal trainer or I have a nutritionist. I'm going to see my nutritionist to get my nutrition on point. No one would think anything odd about that. But I think it takes really a much stronger person to say, I have some sort of personality history and I want coaching for it, because that's the only way you're going to get better.
Yeah, I think that's a really good point. The stigma of working with mental health, it's a little bit different. Yeah, nobody would question you for taking cholesterol medication or diabetes medication, but the amount of people who are, they feel a deep sense of shame about taking an antidepressant, or like you said, people would seek out a personal trainer and they would be applauded by their peers for it, and yet we're afraid to say that we're seeking out a psychotherapist to help us deal with stress or anxiety or a sense of sadness or shame. Yeah, I think it takes a lot of courage.
So what was your journey in dealing with your anxiety? Because I know, so you did the traveling in Indonesia. Because that to me seems very anxiety causing, because you were living in the middle of the jungle. You were living with local people. I think you talked to me about how you were like bathing in a river with random animals around you in the middle of the jungle.
Yeah. So what I would say is, just talking about my personal journey, working through my anxiety experience, I feel really blessed to say that I had a deep motivation and drive for personal growth in that. And it was really shaped by, I just don't want to feel this way anymore. I knew that with where I was with my own feelings of anxiety, depression, there would be thoughts of suicide. There'd be thoughts of not wanting to be here, feeling like life was bleak. And I didn't want that for myself. And what that stirred was this sense of something's got to be different. Something can be different. So I started to journal every day, and that was really powerful for me because it helped me to step outside my own limited thinking. It helped me to examine my thoughts and really say, is that true? Is it true that people don't like me? Is it true that I can't do that? It helped me to really have a sense of reinforcement of, you know what, I actually did pretty good today in all these things. I actually have a lot of people who care about me and like me. And that was a really powerful starting point. The next phase for me was... So
wait, just to stop on that. So did you think at some point that people didn't like you?
Yeah, absolutely.
But that's fascinating because you have a whole tight social circle and support group around you.
Yeah, and I think that's one of the paradoxes. There are a lot of people who nobody else would think that, they struggle with that. And at least from an external perspective, they would be very likable people. They'd be confident. They would navigate social circles well. And I think I would be one of those people who qualify in that way. But I still to this day struggle with at times feeling like maybe people don't like me. Maybe I've done something wrong. And anytime I check that out with people, they always think it's ridiculous. But I think a lot of us can relate to that. You know, we don't always know what's going on inside someone's internal world, and there can be a lot of vulnerabilities, especially for those of us who may have received a lot of messaging growing up that led us to feel like we weren't good enough or worthwhile. But I think the real benefit of something like personal work counseling is that it helps you to recognize it so you don't live with that as your reality.
Well,
yeah.
I mean, so for me, that's fascinating because I don't know anyone that's ever not liked you. And I know of people who have seen you professionally and they have nothing but the highest, praise of you. I mean, they've seen multiple therapists. But it's really fascinating to me that you would have that, I guess, those thoughts, because I never would have thought that about you.
Yeah, you know, and I appreciate you saying that. And I think that's something that I find a lot of people struggle with. I can tell you in my office, I've had CEOs, successful lawyers, physicians, entrepreneurs who appear to have the whole world at their fingertips. And surprisingly, they can feel worthless and terrible about themselves. It doesn't mean that they're stuck in that all the time, but they have those dark moments. And sometimes because people see them in such a positive light, that the shame of revealing that they don't feel good can be even more powerful.
Well, if you're leading a team, there really isn't anyone that you can speak to day to day. Like, it's awkward if you're speaking to someone that you're employing and telling them, I have anxiety, because it would be very awkward.
It can be. And, you know, at least what I've found is anytime I've heard somebody who open up vulnerably about that, it's certainly never made me think any less of them. I've actually always respected and admired them even more. And I don't know if everyone would feel that way, but I think a lot of people would feel, you know, I think they would feel really positively about someone who revealed their vulnerability. I think it's actually human nature to feel more connected and closer to somebody who reveals the truth about themselves, especially a difficult truth.
I can see that. So do you want to talk about your journey from, well, wait, so do you still have anxiety?
What I would say is that as a human being, I absolutely have anxiety. And I think, but the difference is the anxiety I experience is appropriate. And I know how to navigate the sensations and symptoms of anxiety when they arise so that they don't negatively impact my life. I think a lot of people have a misconception that someone with an anxiety disorder has this problematic anxiety, and somebody who doesn't define as having an anxiety disorder doesn't have anxiety. Oftentimes, people have the same anxiety. But the difference is how we cope with and relate to it. So wellness or healing or recovery from anxiety isn't about eliminating it. It's about shifting our relationship to it. You see, anxiety actually has important messages. There's something we can learn from it, whether it's relating to something differently, thinking about it differently. Maybe it's about being more assertive and honoring what our truth is. So for me, my relationship to anxiety is that it has something important to teach me. If I'm experiencing it, I have to listen to it and ask myself, what is it that I need right now? And sometimes maybe I need to take a break. Sometimes I might need to talk to somebody. Sometimes I might need to exercise or meditate or slow down. So what I would say is I have anxiety, and anxiety is actually a really informative companion in my life.
Well, it's interesting that it sounds like you've learned ways to step out of the situation and look at it more objectively. The reason I'm thinking about this is I was speaking with a spine surgeon who was doing a very difficult neurosurgery case. He was operating on the brain for a variety of reasons. And it was a very, very difficult case. And he had to do a full consent where he talked to the family members, talked to the patient, said, like, you could die from this. Like, you're in a lot of pain. This may or may not help you, but you can also die. And halfway through the surgery, after he had a very successful surgery and the guy did phenomenal, but this is the only surgeon that would do this particular surgery because no one else really wanted to take that risk. But I asked him, like, how did you deal with it? Like, how did you deal with that? Because you're dealing with very delicate structures and you may kill this person because it's just a technically very difficult surgery. And he said, well, there were definitely times in the surgical suite that he just had to stop, step back, and take a lot of really deep breaths because as a surgeon and you're in this room, there's really no one that you can call for help. Like, it's you and that's pretty much it. So he, I think, would be the first to say he had a lot of anxiety appropriately so, that day, but I think the anxiety helped focus him and keep him on track.
Yeah, it sounds like you really listened to what he needed so that he could keep going and he could be the one who was more in control of his experience.
So other than the journaling, anything else that you can want to discuss about how you dealt with your own anxiety?
Well, yeah, and I think this also ties to what you brought up earlier about some of my trips and travels. And my focus became around this, what I would almost say, this obsession or drive for personal growth. And that led me to reading a whole bunch of psychological books, self-help and wellness books, spiritual books, often very Eastern oriented in their philosophy base, which I found really powerful for me. And that actually is part of what motivated me to explore and visit Asia. And the way that actually got started for me, as you're aware of, I was fortunate enough to go with the Canadian International Development Agency, which is called CEDA. I was funded to go live in a village in Indonesia and just help out. And the interesting thing was, so I was 21 at the time, took a year off of university, went down there, and I had this idea, like, I'm going to go make a difference. I'm going to go help them out. And I pretty quickly realized when I got there, you know what? I really actually had no ability to help them. These were very self-sufficient, strong people. All I really brought was the resources from my government. But what I can say was the relationships I formed there and what I learned from them were so powerful for on my own wellness journey. Here was a group of people who, by our Western standards, had nothing. They lived in homes they built with their own hands. They had to hunt food. They bathed in the river in the rainforest. They took water from that same river and boiled it. It was often brown, and they drank it. And
So you bathed in that river?
I bathed in that river, yeah.
So let's just focus in on that. So you went from bathing in very nice North American standards to bathe.
Yep.
So when you picture this river, it's hot. It's the jungle. There are mosquitoes all over the place. The water is brown. There's no bottled water waiting for you. There's the occasional dead animal floating down in the water with you.
And not to mention, there could be some dangerous animals as well.
Or little fish that will latch onto you, or leeches So
we were warned about some of these little parasitic creatures that could also exist.
And I think aren't those the ones that will swim up your private parts and just kind of latch in?
Absolutely. We were warned about that very specific thing.
So no peeing in the water.
No peeing in the water. Not that stopped us, but no peeing in the water.
So that I think would cause anyone anxiety. So you have anxiety. How did you mentally deal with that?
In truth, I would say during my time there was one of the least anxious times in my life. And that would seem like a paradox, but there was something about living there and being with them there that was very peaceful and powerful.
Because I'm talking to you about bathing in the water with these little worms that can swim up your private parts and latch onto something it's probably not supposed to be latching onto. And that's causing me anxiety.
And this is where anxiety, it's really a matter of perspective. And if we focus on the danger, it will cause anxiety. For me, the way I had experienced it was adventure. This was adventure. Even the difficulty would be this amazing, wonderful story that I could tell at a future time. So the way I related to it, the way I experienced it wasn't as, it wasn't as a danger. As I said, it was adventure.
So wait, what story are you talking about then?
Being in Indonesia.
Oh, okay.
Right. Just being in the village, being in the rainforest. To me, it was an adventure.
All right.
Every part of it. Now, the people there, I learned a ton from them. And it got me, it actually got me thinking, because I noticed that these people who, there's this stereotype or this sort of idea that, people in developing countries, they have less and they often seem to be happier. And here I actually noticed a real truth to that. And this isn't to say that they didn't have their challenges and problems because, with lack of healthcare, etc. Yeah, those can be real problems. However, on a day-to-day basis, they had a real peace to them. And it sort of helped me to highlight for myself some pillars towards happiness that I noticed. So one of the big ones that they had was community. This was a small village, but every single person in that village was they weren't related, but they were all family. It was this one big, massive family. Nobody was ever alone. You always had someone to laugh with. You always had someone to help you out. And I think in North America, we've lost a lot of community. Few of us really know our neighbors. Few of us have groups that we can see on a regular basis. And they had that. Another element that I noticed to their own joy and well-being was this sense of gratitude. Because they had so little, I imagine that what they focused on in their life was appreciation for what they had, gratitude that I have rice today, gratitude that I had meat or protein, because that wasn't an everyday thing. There wasn't a focus on what they don't have. It was a focus of appreciation for what they do have. Once again, I think pretty different than how we experience things. Another very powerful piece was they had a very strong spiritual identity. This idea of something greater or God being a part of their life was very palpable. It was every day. Everything was about connecting to a spirit or giving thanks. They saw this idea of spirituality in everything they did. And I think that gave them a great sense of peace, a great sense of connection and purpose that I truly admired. And those are some of the foundations that I start to think about in my own life. And it really started to shape how I relate to my experiences, how I relate to what I have and others. I found that very powerful.
So do you want to comment on depression then at that as a segue? Because it sounds like they wouldn't be depressed either, probably because of all of those things you just discussed.
Yeah, I think depression, okay, and this is an interesting piece. I think that's actually a really great question. So depression, I think the rates of depression in that society were far less for the average person. However, I did notice a couple people who were depressed. And the way I see depression, the way depression is often experienced is it comes from a sense of hopelessness, whereas anxiety is about this overperception of danger or threat and not feeling like you can cope with it. Depression is about a sense of hopelessness, and there's not much you can do about it. So some of the people I noticed who were depressed were those who wanted more than the village life, those who may have wanted to have a career or profession or go to the city, and there was no avenue for them. So I see that as creating a sense of hopelessness. And you notice that there were one or two people, there was a deep sadness, and I did have a chance to talk to them. And it was similar to what they said. There's nothing more for me. And while many people were okay with that, they were happy to be in their community, there are others who have this yearning for something different. And I think when you talk to someone who's feeling depressed, they often don't see a way out. They don't see a way forward, or they don't see feeling better. They feel hopeless towards it. And then when we feel hopeless, we often then disengage from life. We isolate from activity and others. And then that reinforces a cycle where we get more stuck into that space of low mood, low energy. The world seems gray.
Just remind me, what were some of the therapeutic techniques that you will use if someone has depression or anxiety?
One of the most prominent and effective approaches is something called cognitive behavioral therapy. And essentially what cognitive behavioral therapy is, it's a framework for creating change. And
so what's a framework? Can you just clarify, what is a framework?
What is a framework?
Yeah.
A framework would be a set of guidelines and ground rules, or just basically a set of guidelines and practices that one can follow to make a positive change. It would be not so different than somebody, perhaps doing CrossFit or Zumba as a framework for transforming their body. This would be more of a mental framework for shifting their mood, how they feel. Does that help?
That helps. I'm just making sure that anyone listening understands the terms we're using.
Okay, for sure. So with cognitive behavioral therapy, they recognize that, it's really difficult to just change your mood. If I said to you, Chris, feel sadness, and then from sadness go shift it to feel worry or feel happiness. It's pretty tough to do that. We can't just change our mood. So for someone who's sad, we can't just say, be happy. It doesn't work that way. We have very little direct control over that. However, CBT recognizes that there are two elements. Cognitive behavioral therapy.
Okay.
Yeah. So cognitive behavioral therapy recognizes that our thoughts, moods, and emotions, as well, or our thoughts, emotions, behaviors, and physical experiences, that's like your heart rate, the sensations in your body, they're all connected. And if you were to change any one of those elements, you could influence the others. So essentially, while I might not be able to change my emotion, I can actually work on shifting my thinking. So if I wanted to become sad, I might think of something sad. That could help shift my mood. If I wanted to feel a little bit better, I might shift how I think about something as a way to moderate my mood. So I'm going to call it CBT. So what CBT recognizes is that we have influence over our behaviors and we have influence over our thoughts. Now, we can't control the thoughts that pop into our head, but we can consciously create thoughts and we can work on how we respond to our automatic thoughts. And by working on creating more adaptive thinking and recognizing our maladaptive thinking so we can shift it, we can improve our mood. By recognizing the unhelpful and unhealthy behaviors we're engaging in patterns, we can shift that and create more healthy patterns. So by using those two variables, your cognitions, which is thinking, and your behaviors, we can then give people concrete tools and strategies to improve how they feel.
And how long does this take? Obviously, if someone's had a negative pattern of thinking for their entire life or most of their life, how quickly do people progress?
People can make changes and improve their mood almost immediately. Now, that doesn't mean that they're not going to still experience depression or sadness. But the way I liken it to, it's imagine somebody was climbing a mountain. And often a lot of us think that depression, recovering from depression or anxiety is like climbing a mountain. And we have this idea that if I'm at the bottom, I got to get to the top in order to be okay. And what I often tell people is that if you took 10 steps up the mountain, would your perspective be different than it was when you were at the bottom? And it often is, very much so. And if you took another 10 steps up, how would you view things? How would you view your life? The perspective would change yet again. So when we're working on something like cognitive behavioral therapy or we're making changes, we don't have to get to the top of the mountain to dramatically shift the way we experience and view our life. You know, sometimes that first 10 steps can change the way we see things. The horizon that we couldn't see before, now we can suddenly see. So, I think that there is a continuous journey that anybody can be on to work on their moods, to work on anxiety. But if we take small steps, our perception of self and life can dramatically change. And that can happen almost immediately.
Do you have I know I'm circling back to the same question. So do you have a rough time frame of how quickly this process happens, or is it just really an individual thing?
It's an individual thing. However, there is some standardized CBT protocols that are often anywhere between 8 and 16 sessions, which would be usually about 8 and 16 weeks. Now, just because you go through 8 and 16 weeks, some people might have been feeling better from week 2. Some people at 16 weeks might still be feeling like they're in a really tough time. And there could be different factors for that.
So do you have some clients that just call you because they really just want to vent? Like, they can't vent to people in their social circle. They can't vent to people at work because it's a professional setting and you have to just be careful of what you say. But it seems to me like there would be a very useful place where someone could just feel safe and know anything they told you would just stay between you and them. And they can just rant about whatever, and then they get it out of their chest and then move on with their day.
Absolutely. There are some people that just love to have that, and they find it really helpful. And you know what I would say? Yeah, what I would aim for people who really like that opportunity to vent is we engage with it in a way of constructive venting.
It's interesting that you say that because some venting will just rev people up more and get them more angry. Right. But if you're venting to the right person, they will actually modulate you and calm you down.
Yeah, we want to have a balanced perspective on it. If someone comes to me and vents about their boss every week, well, while that might help them let off some steam, I don't necessarily want to fuel this idea that their boss is the absolute enemy and work is intolerable. I'll allow for venting and will facilitate with that with a really validating and compassionate stance. And then we'll focus on perhaps looking at one's perceptions that are creating the triggers. Maybe we can look at things a little bit differently so that we're a little bit less triggered and thus more effective in how we handle interpersonal dynamics or even work. Perhaps we'll look at boundaries that would be really appropriate. We want to vent, we want to validate, and then we want to focus on creating balance and effectiveness.
That sounds like a very healthy way of approaching things.
Mm-hmm. Yeah, it can be useful.
And then, so how would you address depression then? Is there a different approach or similar approach?
Well, with depression, there's a similar approach. Well, just to say, with anxiety, what we're doing is we're helping people create a more balanced perspective on the way they're perceiving things as dangers, with the level of danger they're perceiving. We want to help people put that into an appropriate place so that they see situations as appropriately dangerous or not dangerous. And we also want to work on their belief in themselves to cope. With depression, yeah, were you going to say something, Kris?
No, I was just thinking, well, when you said you work on their beliefs in themselves, how do you adjust someone's view of themselves? Like, you have a CEO who typically when people are driving themselves to these extreme heights of success, there's an emotional reason they're doing it. There's some sort of pain that they have or emotional issue or whatever that they have, which is why they need to expend this very large amount of energy to achieve whatever it is they've achieved, because they could have been very content with nowhere near that level of success.
And it's often informative that they're not.
I'm sorry, say that again.
I said it's quite informative about somebody that they aren't satisfied by it. That
exactly.
Really provide some insights into what drives them or what they're moving towards.
So you have someone who, say, is a workaholic, they're very type A, they get everything done they really need to get done, and they are quickly ascending a ladder of success, but they're still really not happy. So the thing that is and I'm really curious to see how you address this, because the thing that is making them successful is also the thing that is causing them a lot of internal pain.
And this is a great question. I see this all the time. The reason we do what we do, at least in the short term, is that it works. It gives us something. And in this case that you're bringing up, somebody who works really hard, they're achieving external success, and yet maybe they're not feeling so good about themselves or their life. And one of the things that I would tend to assess and explore is, with this thing that we're pursuing, whether it's professional success, are we seeking it from a place of expansion of self and possibility, or are we seeking it as a way of running away from something? And often when the amount of work they're doing is leading to burnout, depression, anxiety, I often find that they're running away from something as opposed to running towards something. Perhaps they're utilizing work as a way of escaping the pain in their life. They're using being busy as a way to not face what's been really going on for them inside. Maybe work has been a way for them to feel better about themselves. So long as they have a title or promotions, they could feel good, but it doesn't last. So once they get that promotion, they got to go seek out another one.
Well, and I think it would almost get worse. They say that if someone is, especially if they become, say, a CEO or extremely high up in the professional ladder, once you've achieved that success and you're still trying to fill this hole, it's difficult because you've achieved everything you want to, but you still don't really feel good. You have no excuses for why it's not working at this point.
And I think that's one of the darkest places to be. It's just this, and you can see how depression follows. There's this hopelessness of, I've achieved it all and I still feel empty. So if all this achievement doesn't give it to me, what will? And this is where that paradigm shift, that it's seeking, there's this mix where there's an internal fulfillment and validation that we have to start becoming aware of.
So that covers the depression aspect of it, one part of it. But then the other aspect is the anxiety part of it. Like, say you are a middle-aged person, by all accounts, you've been married to the same person forever, you have a very comfortable relationship, you've had the same job forever, but the reason you've had so much consistency is because you may not be totally happy with where you are at life, but any sort of change is going to cause you an extreme amount of anxiety. So even though you've had the same life partner forever and your kids are doing great and you've had the same job forever, it's good, but it's not really fulfilling to you. And the reason it's not fulfilling to you is because it's what's comfortable. So you go through the motions day after day after day, and it just becomes Groundhog Day. And it's not coming from really a sense of joy. It's what your life is.
Yeah, it's what your life is.
So how do you address that person? Which I think is a lot of people.
A lot of people. Yeah. I think one of the driving forces behind humanity is growth. You know, we're never finished products. We're meant to grow, to expand, to explore. Some of us explore externally, some of us explore internally. I think a bit of both is important. And if life looks the same day in, day out, it's not that can't have value. But if we're not growing, I think in a sense we're actually falling behind, we're stagnating. And as human beings, there's something about that creates a sense of hopelessness. And, you know, maybe for that person you're speaking of, or some example of it, maybe the reason they haven't changed anything is that there's a fear. There's a real fear of change that's underlying that. And that would speak to anxiety. And there can often be a sense of both.
I think that's just a quality that applies to many people, men and women. And I think if people really look at their lives, I think a lot of people will say, well, I'm probably doing these things just out of habit versus this is something I want to do just because I really want to do it.
Mm-hmm. Yeah, that's a great point. I think a lot of people aren't living a self-determined life. You know, we live within what we see as the confines of our jobs, our finances, our relationships, our passports.
So I appreciate your time. I don't want to keep you too much longer, but do you have any closing thoughts or advice for people who say are suffering from anxiety or suffering from depression?
You know, what I would say is if you are experiencing anxiety and depression, either one of them, talk to somebody, get help. I know that there can be a lot of vulnerability and fear about that. And what I would say to you is that's the bravest, most courageous step you can take. Opening up, taking that step requires courage. You know, I know that there's shame and there's fear, but in truth, it's something to be admired. There's something very powerful about it.
So how would you pick a therapist though? Because like all professions, there's some very good therapists and there's some not good therapists. And while I think you're great, there's only one of you. So,
well, thank you.
How would someone screen their therapist? What are some things that they should really look for?
What I would highly recommend is that fit matters. You know, it's not just approach. I mean, I would recommend for anxiety and depression somebody who has knowledge and specialization in cognitive behavioral therapy and mindfulness-based approaches. I would encourage somebody to speak to that therapist. The connection and that sense of the vibe you get matters. If you're talking to them for 10 minutes and you don't feel like they're understanding or empathetic or helpful, it might not be a good fit. Ideally, after talking to them on the phone or in person for 10, 15 minutes, if you feel like they're somebody who genuinely has a caring and empathy and an insight and understanding, that's a good sign. Okay. We also want to be aware that sometimes when we're reluctant to get help, we might be looking for any reason not to move forward. But still, what I would say is relationship and fit matters. So see what the vibe is. Talk to them. Talk to multiple therapists. You know, like anything else, it's like shopping for a house or a car. It's one of the most important decisions you're going to make. Do your homework, do your research, and, you know, be picky. Pick someone that's right.
And if you have 5 more minutes, what's mindfulness, the mindfulness practice that you discussed? Sure. We skipped over that.
Okay. Well, mindfulness is, you know, it's considered a second or third wave of treatment that's come about. And a lot of people now have been using the word mindfulness in popular lexicon. You know, be mindful. I was mindful of something. Essentially, what mindfulness is a quality that we can cultivate with various practices. Many of those practices would be meditation based. And the quality of mindfulness is about being able to be present to our life in a way that is non-judgmental and compassionate. So many people have a difficult time being present. Instead of sitting down with a loved one for a meal, their mind is in a million places. So many of us have missed out on huge portions of our life because we just weren't there for them. We were there in body, but we weren't there in mind. We're eating a meal, and before we know it, we barely tasted it. It's been consumed. It's gone. So mindfulness is about engaging in practices that help us to be present, to experience what our experience is in a way that is compassionate and non-judgmental. And that can be one of the most powerful things anyone can cultivate. With mindful awareness, we start getting attuned to our early warning signs for depression or anxiety. It helps us to then be able to take skillful action. It helps us to not suppress. Especially with anxiety and depression, there's often a huge element of suppression of emotion that then builds up and becomes this reservoir that fuels a depressive episode or a panic attack. With mindful awareness, the ability to experience it as it occurs and then take skillful action can often diffuse it in a really effective way. It can often help us to cultivate more powerful relationships. It can help us to build our focus so we can tune into things and take in information. So mindfulness in and of itself is one of the most powerful practices that we can do. And for anyone who's interested, I think check it out. Find a way to build that.
It is interesting because I refer a lot of patients over for mindfulness meditation and cognitive behavioral therapy, and the results are sometimes very quick and very dramatic.
Mm-hmm.
So Nick, thank you very much for coming on the podcast. It was fantastic hearing your story. Also, thank you for being vulnerable and discussing your anxiety issues. And I think you'd be the perfect therapist to help someone with anxiety and depression, especially since you've had those issues and you've gotten over it. I think it would be really difficult for someone without those issues to really help someone else, because it would be just hard to empathize and understand where someone's really coming from. So I think it's a very powerful thing you're offering. Do you want to leave your contact information?
Yeah, absolutely. For anyone that would like to just ask me a question or get in touch with me in any way, you can check out my website. It's nicholasmarajcounseling.com. So yeah, once again, nicholasmarajcounseling.com. Just Google me, check it out, reach out.
How do you spell it?
I'm happy to answer any questions. So that's NICHOLASMARAJ counseling, and that's counseling with 2 L's.com.
And you are located in the Greater Toronto area?
Yeah, I'm located in Toronto.
Great. Well, Nicholas, thank you so much.
You're welcome. It was my pleasure.
Thank you for listening. If you enjoyed this podcast, please subscribe and visit the Get Healthy 360 Facebook page. We are always looking for feedback and new story ideas. Thanks again, and see you next time.